Good afternoon, and we would like to welcome you to the launch of our Caribbean Tourism Health Safety Training Series with today's topic, Tourism Health Safety 101. This webinar session is scheduled through 5 p.m. Eastern Standard Time. We hope that you can join us for the entirety of the session. Before we proceed, we'd like to go over a few housekeeping items. All of the attendees have been muted to avoid any disruption. You are welcome to submit your questions exclusively on the Q&A box. We want these questions specifically on the Q&A box to facilitate the panelists being able to get through the questions, but also if we are unable to go through all of the questions that are submitted, your question will be recorded and we are able to refer to it and respond to it after. The chat box, it's not available, so please we ask that you put all of your questions on the Q&A. The video recording of this webinar will be available at the CHTA website within the next 48 hours. Today's panelists are Dr. Lisa Indar from the Caribbean Public Health Agency, as well as Ornella Cyrus from CARFA. And today's topic, Tourism Health Safety 101, and this overview will be what we will be going over for the next few hours. We just actually, about an hour and a half ago, we just launched the regional guidelines for the reopening of Caribbean tourism and travel. And this series is developed based on all of those guidelines and checklists that have been launched. The full document is available on the Caribbean Hotel and Tourism website's homepage. And the guidelines cover the sectors of ground transportation, accommodation, food and beverage, and recreation and entertainment. Individual sections of all of these checklists will be available within the next 48 hours. We really invite you to go to our website and get all of these. We also want to make you aware that on our resource center, we are tracking all of the Caribbean travel advisories as well as opening dates for destinations and hotel properties. If you are joining us today and you are a hotel, please make sure that we receive from you the information on when it's your opening date, so that information is also available on the travel advisories. We also want to make reference that our next session of the Health Safety Training Series, it's next week, Wednesday at 11 a.m. through 12 p.m. specific to accommodations in public areas. All of the participating businesses will be recognized and accommodation providers may be eligible to receive the Caribbean Traveler Health Assurance Recognition Stamp. Each individual that attends the session will receive a certificate of participation within the next 30 days. Para todas las compañías y negocios de habla hispana, estaremos proveyendo también estas sesiones en español a las 3 de la tarde la semana próxima. El tópico es alojamiento, áreas públicas. And with that being said, I want us to get right into our full presentation for the day, which is being led by the CARFA team. At the CHTA, we're very glad of the collaboration and special partnership with CARFA, but also with the other regional stakeholders, the Caribbean Tourism Organization, the Organization of Eastern American States, and the Global Resilience and Crisis Management Center. One of the highlights of these regional guidelines and checklists is that it's the only set of tourism guidelines that have been developed with the complete support and approval of a public health agency, which is something that it's very special for the region. With that being said, I'm going to turn it over to the CARFA team for today's presentation. Dr. Indar.
Good morning, good afternoon, everyone. Yes, we are very happy to be partnering with CHTA to conduct this training. We would have developed a set of interim guidelines for health guidelines for reopening the tourism sector, which we are very, very happy here today to be discussing this with you all as the key implementers of these guidelines. And this actually fits, these guidelines, as well as other documents, would have formed the basis for the CHTA operational checklist that is on their website. And in terms of some housekeeping as well, we would have sent a PDF of this document out, and that can be shared with everyone. Okay, so we'll get straight into it. In terms of a simple background, we know that there was a COVID-19, that we're currently experiencing a COVID-19 pandemic. Pandemic meaning it has gone through more than, it's distributed over the region or globally. And when something is declared a pandemic, the idea is that you can repurpose your resources towards addressing that pandemic. So on March 11th, it was declared a pandemic. Most of our Caribbean countries have reported at least one COVID-19 case. To date, we have about 33 countries. And we still assess the risk to the Caribbean as being very high. And so our aim to work with our partners is to ensure we are stopping transmission, whether it be imported cases or transmission within the community. Countries would have already developed their measures for prevention, and this includes social distancing, restriction of movements, wearing a face mask and other things to help slow the movement. So what really is this virus? Well, first I want to say it's a virus and not a bacteria, meaning that it is very small, cannot be seen with your naked eyes, but it spreads rapidly by person to person through person to person transmission, meaning by touch. So because of that, you tend to see a bigger spread as opposed to a bacterial type spread. It belongs to a family called coronavirus, which includes SARS, the severe acute respiratory syndrome, and MERS, which is the Middle East respiratory syndrome. However, it is a new strain, meaning it is different even though it's into the same family. So this is why we call it COVID-19, because it is a new strain. And so even though it has the same family, it's like, your brothers and sisters, they one family, but they are different. How is it spread or transmitted? So it's spread person to person, and it's spread between 2 to 14 days. So this is why, because of this information, we have that incubation period until 14 days, meaning, and if a person is sick, then obviously you want to ensure that you keep them away from other persons or isolate them then until that 14 days to avoid risk of infection. Currently, it is spread based on our data through large respiratory droplets. It means someone is coughing and that respiratory droplet gets into the air, and when a person sneezes or coughs, and you can easily pick it up if you're very close to them. Hence, again, because of this science, we have social distancing, so you're far apart to avoid that respiratory droplets coming onto you. The other way is by direct or indirect contact with infected secretions, bodily fluids, and also through surfaces. What does that mean? A person may sneeze or cough and those respiratory droplets falls on the surface, then someone touches that surface and touches their hand and touches their eye, their nose and mouth, and it's transferred to you. So the data shows that it can stay about 24 hours on cardboard, 2 days on wood and cloth, 4 days on banknotes, and up to 7 days on stainless steel and plastic. So even more important for cleaning and sanitizing, and even more important than, to ensure that you are wearing your face guards to avoid picking up illness when someone is sneezing. Now, there is no evidence that COVID can be spread by water, or mosquitoes or food. So I want to stop here to say, we are in the Caribbean and we are experiencing, once this rainy season has started, we will experience, mosquito-borne infections like dengue and Zika and all of that. And that has a similar symptoms. So it's important to always distinguish if it's COVID or dengue or Zika and so on. So this slide just really reiterates what I just spoke, transferring from person to person when the person sneezes, from your nose or mouth, via droplets from the nose and the mouth, also by contact and when you touch surfaces. How do we recognize if someone is really infected? Well, we look for symptoms or your clinical presentation. And your symptoms, the most common is fever. Fever is any temperature above 37.5. We tend to say 38 degrees. So that means you're definitely having fever and not just a warm body. And because of that, you have temperature screening as a measure or layer of control, because you want to look for that level of screening to ask if a person has fever. But it's not just fever. It has to be fever with something. So fever with shortness of breath, or fever with fatigue, or fever with cough or muscle pain. So it could be one or many of the other symptoms, but not just fever. Okay? So this is something you, as in the hospitality sector, as you reopen for your hotels, to really educate your workers to know that, in taking the temperature checks, once a person has fever, but they're experiencing these other symptoms of shortness of breath, fatigue, and cough and pain and so on, that, you're possibly looking at a suspect case. And what do you do if you have a suspect case? You immediately isolate that person. Isolate means that you put them away from everybody else. So they should go in a separate room, and nobody should be going in and out and be interacting with them. And you isolate, and then you contact Ministry of Health so that they will be able to deal with that person, confirm if it's COVID or not COVID. Now, these are the clinical symptoms, or how it, what to look for. But most of these cases are actually mild. In fact, right now, the disease has kind of changed. Almost 90% we see as mild. So it means a lot of us may be going around with it because it's a mild fever, and I may have fever and tired, and I may not realize it could be COVID, but this is why it's important to test. The problem is my symptoms may be mild and I may not realize I have COVID, but then I may transmit that to someone else who may be more susceptible or more likely to get the illness, and then they may have a severe or a critical case. They may become a critical case. So it's important then to test, and it's important to know so that we avoid that. So right now, less than 5% are critical. Those people are required to be hospitalized. So in addition to these symptoms, they would have respiratory failure and multi-organ failure, pneumonia, and so on. They would be required to go to the hospital. We have seen, well, we know the data, lots of cases, about over 8 million cases to date, and we have a lot of deaths. Okay. The other thing I wanted you all to note too is the difference between a case that is imported and one that is local and one that is community. An imported case is that is coming from a traveler. So whether it's a returning citizen or someone from the US or the UK, once they are traveling and they're coming in and they have a case and you are tested here, meaning that they have left that country, let's say they're coming from the US, they left not sick, but they came here and they developed symptoms and they tested positive, that will be regarded as an imported case. A local case, though, would be no travel history at all, but they were exposed to an imported case. And this here is very important because this is what the likelihood that may occur in the hospitality sector. Your workers are there, and those are the persons who will then be exposed to a traveler. And they can then likely be exposed then to an imported case So it's important to do your temperature screening and look for symptoms so that you are not likely picking up any illness. And a community spread, these are persons in the community who would have developed the symptoms, but you have no travel history, but they spread not just, number one, but one or two cases, but within a community. So I gave that background because it's because of the science of COVID, how it spread and where it survived. This is why we come up, there is the international guidelines as well as the regional guidelines on how to really protect the health and well-being of someone. So this slide really kind of captures some of the general health guidelines that should be incorporated as part of your operational guidelines or checklists, or that becomes your norm, your daily activity. Just as how you would establish HACCP plans and your daily work plans, this now becomes part of your daily routine checklist. The first is temperature screening. We spoke why it's important to do temperature screening. You want to check for someone's temperature. You want to check your visitor when they arrive. You want to test your workers daily to ensure that they do not have a fever. That's the first sign of COVID. Okay, and how do you do that? You get a temperature gun or a temperature a thermometer that does not have to touch someone's skin. So we call them temperature guns. Actually, these are, you can just point at a person and it registers electronically and it records that reading. The second thing is social distancing. We cannot overemphasize why this is important. If the virus is spreading when somebody's coughing and sneezing, and it's truly a respiratory droplets, then it makes all the sense in the world to stay away. And the shortest distance is 6 feet or 2 meters. And I say shortest distance because someone asked the question yesterday on if we should do less than 2 meters. When the science normally gives you the minimum requirements. So the minimum requirements is 6 feet or 2 meters apart. So really, if we're doing social distancing, we must meet that 2 meters. It means when people are dining, when they are lining up, how we work, and it should be 2 meters, and if you want to go better, 2 meters and above. The third is sanitizing. We cannot overemphasize why it's important to do hand hygiene and hand sanitizing. Because this is a virus, it tends to spread by person to person. And we know that you can, if someone coughs and sneezes on a surface or sneezes on their hand, then it can easily transmit to someone else by handshaking or by touching, or by their hands touching a surface and someone else touching. So washing your hands regularly and as often as possible is a key measure of reducing this illness. And following washing, you do proper hand sanitizing. For all this to be effective, you want to make sure you are putting hand sanitizers in all the key locations where there is likelihood of frequent touching. So things like entrance areas, driveways, receptions, hotel lobbies, restaurants, entrances, convention spaces, elevator landings, pools, and exercise areas, and so on are important. The fourth measure is face covering. Now, why is that important? We just spoke how the illness will spread. So if I have a face covering and I'm coughing, then my respiratory droplets is not going to the other person. Or if I have a face cough covering and somebody is coughing, then their respiratory droplets are not coming to me because I have a barrier. So face covering is almost a mandatory requirement in all of our Caribbean territories now as an added layer of protection. And we can't do none of this if we don't keep reminding everyone. So we need to have signage at the back and the front of our house that really talks about encouraging people to social distance, wear their face masks, to wash their hands, to use hand sanitizers, and so on. So This slide kind of just reiterates what we just said, making sure we're doing social distancing, washing your hands. If you're coughing, cough on your elbow as opposed to coughing so that the droplets could go out. And then the other thing that is important, if you are sick, please stay at home. Alert your employee and stay at home. I'm going to go now into some of the other measures, the specific measures by area. And this that by no means are going to reduce the different training by sector. It's just we're referring or focusing on the health measures. So for every establishment that you have some designated guest transportation, and I think this might be the new norm to have registered taxis to bring your guests, because you want to ensure between the time that the guest arrives and by the time they arrive at your hotel that all measures have been taken to ensure that they have not undergone any form of risk of transmission. So first thing, every person should wear a mask. The taxi driver must wear a mask and the patrons must wear masks. They must have hand sanitizers. They must put on that, use that before they enter. And that there must be social distancing. So because of that, some jurisdictions have said that, it's 50% occupancy. So you cannot really, crowd up everybody and, and says, well, you can fit and that fit, and try to see how everybody can fit. You really need to social distance. And you have to make sure you're having proper proper sanitization of all the key touch areas. So your seats, your steering wheel, armrests, door handles, seat belts, air controls, light and air controls, doors and windows, your grab handles and so on. They must be sanitized frequently. How frequent is frequent? Well, generally, you need to do thorough cleaning and sanitization in the morning and in the evening. And you need to also do thorough cleaning and need to also sanitize between every new set of persons your person's transporting. So after every drop or after every pickup, you sanitize in between. So, and all of these are available. We would make all of these available onto our Travelers Health, our Tourism and Health page that gives you all these nice little infographics that you can print out and feel free to use in terms of summarizing the key health messages. So this particular infographic here really summarizes the key health message for transportation. Wearing your mask, we're not mixing your travelers, making sure that the travelers are performing hand hygiene, and sanitizing between travel and before and after. So that takes care of transportation. Let's go on to when the guests arrives at the hotel. We cannot overemphasize the importance of taking the temperature of the visitors. Yes, the temperature may have been taken at the airport, but you, this person is now coming into your facility. You have a responsibility to protect all your other guests and your workers. And you want to ensure that a person who now is arriving into your facility is not sick. So taking temperature checks before they enter, so definitely at entrance or at the concierge area is most important. Also, when they enter, you want to ask them to use hand sanitizers. You want to show, display appropriate signage, like to ensure that they're doing face covering and doing physical distancing. And a good way is to do the markings on your floor. That 2-meter markings, people tend to follow instructions well. So I would recommend that, indicate to persons, even in your communications, that you will be subjected to temperature checks. Please wear face covering and practice social distancing and do your markings like at the check-in areas and so on. The employees should not open the doors to the taxis and so on to avoid contamination. The whole issue of luggage and all of that will be taken by certain people and sanitized before it gets to the rooms so that you're avoiding contact as much as possible. Other things to note from a health point, you want to ensure that the elevators are always clean and sanitized. So designate someone to disinfect the button panels. Now, there was a study that showed that an elevator is 4,000 more times likely to get someone infected. Right? So that's how important it is to keep sanitizing those buttons because someone is using their fingers and touching. You want to post lines to explain the procedures, and generally for your normal size elevators, not the very small ones, but you know those that hold between 8 to 10 persons, you should then reduce that numbers to 4 to allow for social distancing as much as possible. Then at the guest rooms, you want to ensure guests be assigned a room that has been thoroughly cleaned as well as disinfected. That's important because cleaning and disinfection is two different things, which I would explain in the next couple of slides. You should show there must be a proof of disinfection, so some form of record to show that that room was disinfected or sanitized properly. Moving on now to employee health and your personal hygiene. Again, this cannot be overemphasized. The health of your employees will determine the success of your business. We have to focus on making sure our employees and providing all the necessary equipment and facilities to ensure that they are healthy. And we have to ensure too that we can monitor their health and their personal hygiene so that they do not become ill and they do not be a risk to the visitors or vice versa. So 3 key things: hand cleaning or hand washing. You want to make sure that all your employees are practicing proper hand washing. They're doing it regularly. That hand washing should be done, over a period of 20 seconds using warm water, and following hand washing, then use sanitizers. Training, like what you're doing here, this set of training is the first set of training that we have started, and we have to continue doing this training because only by knowledge is the most important tool for learning, and then taking what you have learned here and put it into operational guidelines. The third is personal protective equipment. So things like all these things that are going to protect you, your gloves and your mask and your hairnets and all those things. You as the employee should make sure that it's well available. Do not assume that your employee is going to have clean gloves and clean masks and enough to change daily between tasks. You have to make sure that's available. And finally, if a person is sick, is experiencing any types of illness symptom, not just COVID, like if they have fever for COVID, or if they have other things like diarrhea and other illness, they should stay at home because they are at risk for transferring this illness to someone else. And these are some infographics that's available, and we can make it available to you, about hand washing your hands regularly, and then followed by a sanitizer, employee personal hygiene, training, if you're sick, and of course, social distancing. This slide really speaks to what are the steps for proper hand washing, and the entire process takes place over 20 seconds. So we tend to tell people, sing the happy birthday song, or Mary had a little lamb, but you want to encourage a process. So you need to wash your hands, wet your hands, and then the washing and the scrubbing in your hands, that takes about 10 to 15 seconds. So you have to wash your hands thoroughly on both sides. You're scrubbing under your nails and between your fingers and so on. And then all of this has to be done under running water. Then you rinse thoroughly, make sure that, visibly your hands look clean. You turn off the tap, you take a disposable towel, you turn off your tap, you dry your hand with a single-use disposable towel. And once you're finished, then you sanitize. Now, if this is a situation for proper hand washing, then it goes without saying you as hoteliers need to ensure that you have proper hand washing facilities, not just for your visitors, but for your employees. You must have running water. It should be warm. You must have a liquid soap to avoid that touching of the soap. You must have, disposable towels to dry your hands. You must have signage, and you must have a hand sanitizer so that proper hand washing can be done. A little bit about face covering. This question was asked before in terms of, what is the best one to be used? Well, first there's medical versus non-medical. The medical are those surgical masks that you see, and to put it short, this should be done by this medical person. So the only person should be using this in a hotel facility will be your nurse or doctor if you have a nurse's station. Otherwise, the other type of mask that is really appropriate for the hotel, for your workers and for your visitors, is your non-medical face mask or your cloth mask. And this particular mask really is for a barrier to prevent you from infecting someone or prevent someone from infecting you. So there are many cloth masks that are available. The key is that, to wear the mask. These are not regulated by the FDA. But the key is to wear it to be as a physical barrier. How do we put on a mask? Well, let's just think about it. If we touch the mask, we can contaminate the mask. So we want to avoid touching the mask itself. So before you even think about putting your mask, you should properly wash and sanitize your hands. And then you hold the mask by the straps. And it's the strap that you're using as you bring up the mask to your face, to use the straps to put it over your ears so that you are not touching the mask itself. Once your mask is on your face, you can use your hands then to touch the outside of the mask to fix it to your face. All right. A question here was asked in our previous training is how long you use masks for. Now, masks are only efficient in terms of if they're dry or wet. So if you are sweating a lot, or if you're doing any activity where your mask gets wet, you want to remove that mask and put on a dry mask. The same would apply for gloves. CAFA does not recommend the use of gloves like in public to avoid that false sense of security. However, gloves are recommended for a couple of things, like if you're using ready-to-eat food and you're serving ready-to-eat foods. So we recommend the gloves, but the gloves should be single use, and you change your gloves after every task, the same way you would change, your mask if you're doing different things. Okay. Let's move on to cleaning and sanitizing. There's a difference between cleaning and sanitizing and disinfecting. Cleaning removes dirt. So you want to remove dirt and grime before you sanitize. And sanitizing reduces the number of germs or pathogen, which is really the ability of a germ to cause disease. So it is not just good enough to sanitize a table with a sanitizing solution after someone has eaten. You want to first remove any dirt and debris with soap or water, and then you use an appropriate sanitizing solution and sanitize. The important thing here about cleaning and sanitizing too is to know that one comes before the other, and note that you must use appropriate cleaning compounds and appropriate sanitizing compound. Do not dilute them because then they are not effective. And of course, you cannot use the same cleaning compound, soap and water for the entire day. When you see the dirt and grime building up, you have to obviously change it, and that depends on how frequent the traffic is in terms of how much cleaning you have to do. In terms of just going through the cleaning process, you can use a number of routine detergents. Because you're in the hospitality industry, you have to choose food grade or the cleaners that are safe to use and safe to handle. You want to start by cleaning the surface of any dirt or visible soiling using a clean cloth, warm or hot water, and appropriate soap or detergent. Then make sure to change your water and cloth or soap frequently. And then after cleaning the surface, if it's not visibly soiled anymore, it can then go forward for sanitizing and disinfection. What is the recommendation for sanitization and disinfection? The recommendation is to use a sanitizing agent or heat. We tend to use liquid sanitizing agent because it's difficult to use heat sanitizing regularly, except probably in dishwashers and so on. And the active ingredient for sanitizing in most liquid sanitizers is sodium hypochlorite. So the common name for that is bleach. So when you're choosing, so CARFA can't recommend which one to use, but when you're choosing, you want to be able to choose cleaning and compound that has sodium hypochlorite in it. You also want to ensure that you're diluting it properly. So normally a 0.1% dilution is needed for contact over 10 minutes. And depending on if you're dealing with that, there are some illnesses, which is not COVID, but like norovirus, it requires deep cleaning and sanitizing, meaning it may have a higher concentration. If you're using alcohol as a sanitizer, for surfaces, the alcohol content must be 70% or above. And to clarify that, when you're sanitizing your hands, the alcohol content should be 60%, but if you're using it for surfaces, it should be 70%. And again, these are your minimum standards. So if you were to go above that, your hand washing should be 60% and above, and for cleaning of surfaces, it should be 70% and above. What should be sanitized or disinfected? High touch areas. So you know your high touch areas, and they should be disinfected regularly, especially if you have more than one person, for instance, using the telephone and so on, or high traffic. So telephone, fax machines, elevator buttons, toilets, faucets, bathrooms, showers, light switches, staff, computers, remote controls, and so on. So the key to all of this is to create a schedule. So as hoteliers, what I would like you to take from this is, you have to develop a cleaning and sanitizing schedule that really then works with this to ensure that these high touch areas are clean and sanitized regularly. Let's move on to dining. So from dining perspective, we know that COVID-19 is not a foodborne illness. So that's the first thing. But we also know two other things. Among our travelers, and from the data that we have, most type of illness that we tend to get is traveler's illness, meaning people eat food and they become sick. This is either due to poor handling, or because someone didn't wash their hands properly and then they contaminated the food. So our food preparation is really about ensuring that you reduce the risk of any foodborne illness, or also you are cleaning and sanitizing to reduce the risk of anybody who have had COVID from spreading it onto the surface, whether it be a food contact surface or not. All right, so the general things about hand washing, social distancing, keeping 2 meters or 6 feet apart. Before you prepare any food, you wash your hands properly, you clean and sanitize, you wear your proper food attire, meaning your hairnets and your proper uniforms and your aprons. And now you have another attire where you actually now have to put on masks. And then you have to repurpose your kitchens and your food prep areas to ensure while you're doing all that, you're keeping 2 meters or 6 feet apart. Now, when you're doing delivery, you obviously have to do the same thing for pickup service. The persons have to wear masks and they have to keep 6 feet apart. For receiving, all your vehicles that are coming in, obviously the same practices we have just said. The vehicles must be clean, they must be sanitized. The persons who are delivering, they should wear appropriate attire, meaning coverings, they must have face masks, hand hygiene must be practiced when they're entering. Proper cough etiquette, they must have to take temperature checks as well as washing their hands and so on before they come in. For preparation, limit your staff in your food prep area Now, I know this is going to be a challenge in your high flow kitchens, and especially in your all-inclusive areas, or when you have, like let's say you have a high amount of patrons. So you have to kind of work and operationalize your kitchens in such a way now, your tasks in your kitchen, that you're social distancing as much as possible. So separating your tasks and separating your activities, maybe in different time frames throughout the day. For food preparation, again, washing of hands is important before any food preparation. And again, I cannot overemphasize the need that for the hand washing station to be appropriately, I want to say with a tile, but to have all the prerequisites. So for instance, in many hotels, when you go to the visitor's bathroom, it's very nice and has everything on it. But if you go to the workers' bathrooms, you would see that they do not have, soap, or you do not have hand towels or paper towels and so on. The most important thing is your workers must be healthy, and you have to make sure you equip them with those things to be healthy. Okay, for food services, again, you want to limit your customers in the building. So this is why we encourage your social distancing, but, drawing little, placemats on the ground so that people are allowed to social distance. You want to encourage customers to take out rather than dining, but I know we are opening our dining areas. I'll discuss that in a little bit. You must ensure that you have appropriate signage, and before a person enters, whether they are dining in or taken out, they must wash their hands. They cannot come in without a mask. So they're washing, they're drying, and they're sanitizing before they enter. Areas where the customers have to form lines, you want to place marks on the floor to help them comply, provide verbal instructions to customers and staff at the start of each dining session on the need to maintain physical or social distancing and to practice proper hand washing. You should also install your sneeze guards on your buffets to protect food displays from the customers. And anything that is going to create a physical barrier, these are the things that you need to install. You encourage your diners to register or keep a record of your dining customers to enable contact tracing. If you did have a situation where someone got sick, you want to instruct patrons that feel sick or appear to be sick that they should not enter the building. The food could be taken to them. Avoid contact as much as possible. You want to appoint a staff to monitor food displays on buffet lines and to guide customers. Replace your buffet serving implements frequently with new ones, frequent clean and sanitizing, and of course doing regular temperature checks and reporting any incidents that may occur. But for room service, this is going to be a bit tricky because again, avoiding contact. The key with COVID is to have contact less or avoid contact. So you want to wear appropriate PPE, face masks, gloves, display at all time. Have a system of contactless delivery, meaning that staff can knock on the door and they can wait for answer, then leave the food there. The person inside or the patron inside will be able to get their own food, and then they'll be provided with a plastic bag that they can place their utensils in for housekeeping to pick up at a designated time. So we just spoke about cleaning, food handling, and staff. This is just a repeat to reiterate. Now for your dining areas. So we have now opened our borders, and many countries are reopening dining. There's the same set of measures. We cannot re-emphasize it, is that physical distancing or social distancing, wearing of masks, cleaning and sanitizing, hand hygiene. So you have to take that now and apply to your dining. So you may not be able to have, the amount of tables on your dining room because you must have that social distancing or physical distancing. You must have your staff, especially because now they're going to eat. You want to ensure strict hand hygiene when they're entering the restaurants and exiting. Your buffet and drink machines should be if they are to be handled by guests, they should be disinfected regularly or have someone placed there. install sneeze guards and physical barriers to keep customers separated away from each other. All your washing dishes, silverware, and table lining, you want to ensure that that they are washed and disinfected properly. You should encourage guests to eat in your room because of the limits. It limits contact. And in areas where customers have to form line, again, do your markings on the ground. Table setting should be as such that distancing should be encouraged. Really, in terms of rules, the distance between the back of one chair to another should be 2 meters apart. And it is also recommended that a maximum of 4 persons within 10 square meters. Coming on now to pools and spas. Again, no evidence that COVID can be spread by pools and hot tubs and so on. But what's important here is cleaning and sanitizing between use. You want to ensure that all your pool, everything around here, your chairs and your bar areas and the spa areas are clean and sanitized regularly and between use. You also want to ensure that your pool chlorine is kept between 1 and 3 milligrams per liter, not just in your pool, but include any other recreational water, your hot tubs and so on. And also the pH must be between 7.2 and 7.8. So this becomes part of your operational guidelines to reduce the risk of any form of growth of any bug. And it would not be COVID because COVID is not transferred, but there can be other bugs that can be transferred. You want to disinfect your chairs and your toys and all your pool equipment between uses. So now you have to assign someone to the recreational and the pool areas to be able to monitor the use, and as soon as somebody has gotten up, you have to clean and sanitize between uses before someone else comes. Other areas for consideration. Public spaces and communal areas, cleaning and disinfecting should be done frequently. And again, this should become part now of your operation and have a cleaning schedule, doing it multiple times a day, and of course, emphasis on high-touch areas. So we spoke about that. Some of the other things like elevators and door handles, your ATM machines, and so on. Your front desk, your concierge, your parking services, they should practice social distancing as well. They should wear masks as well. We should try to encourage reduce contacts as much as possible in these areas. You can have self-parking option as opposed to have someone, someone jumping in a car and being able to park your car so that you're avoiding contact. In terms of laundry, of course, normal laundry practice, but any laundry that is soiled or very dirty or have any sign of vomit, they have to be washed separately from your normal laundry so that they do not mix or run the risk of cross-contamination. Your convention and meeting spaces, they should allow again for physical distancing. So it's the same principles we would have said from the front in the beginning. So physical distancing, so hand hygiene, mask, to avoid spread. So we are down now to the end. Those are some general health guidelines. But in addition to doing all of this, we want to encourage all the hotels that are in this training to also implement a way to monitor illness. The biggest thing in being able to respond is knowing, and then knowing on time. I'm sure you are seeing what's happening with COVID and other outbreaks of illness where most of the time it spreads very quickly without sometimes you even knowing when it comes to large numbers. So the key is to have a system of monitoring that can monitor very quickly and to be able to, so it triggers a rapid response. So our tourism and health program has designed such a system. It's called the Tourism and Health Information System, which our epidemiologist, Ms. Saras, is going to speak about. This system is real-time, meaning if you enter information, instantly it analyzes it, and you as a hotelier gets that information in the form of a graph or analyzed by person, place, time, so that you can do something with it. The way how the system is too, is that it not only analyzes, but it gives you an alert by email if something is happening. It is confidential. Your information is your information. It is only shared with Ministry of Health when you have an issue to deal with. And so a next hotel is not seeing your information. We want to encourage persons to use this. Any hotel that is registered on this, on the THiS, will be registered in our Travelers Health app as a hotel that is using healthier, safer measures or proactive measures for tourism. So that's important. You are getting free PR or free advocacy work through our app if you're going to be registered. And being registered onto the THiS and using the THiS, as well as undergoing training like this, also helps to fill the prerequisite of your hotel being recognized as for a Caribbean Travelers Health stamp of approval. So it all comes down to this, why we're doing what we are doing. We are reopening our business, and we have developed this suite of proactive measures. I just spoke of the real-time monitoring system. Then we have the health guidelines, which is what you are doing now. We have training and capacity building, which we will continue to do, and the operational checklist that Vanessa spoke about in the beginning. We will continue later on after September with some advanced food training and certification, as well as training in our hospitality, health safety, food safety, and environmental sanitation guidelines. You will have available to you to report on the THiS or on the app itself via your phone. And all of this will come down to making sure that you are regarded there as a healthier, safer facility, and advocating that and communicating that on our Travelers app, through our CHT, CTO, and other websites, to our regional and global partners. So your hotel then is seen as being more proactive, and it gives the guests reassurance to choose your hotel because you're doing more proper measures. Okay, so I think this is the last slide. I think this just shows the app that is going to be launched in a couple of weeks. I've been saying that about a month, sorry. It's at the App Store. We're just going through a lot of back and forth because, believe it or not, a lot of people are developing COVID-19 apps right now. So we had to show proof that we are a public health agency and we are recommending this for regional use and so on. So the app is going to be up. As you can see here, under alerts, you can see a number 2. I'm not so sure if you can see that, but right now the 2 alerts we have for the Caribbean, if you go into that, you will see dengue and COVID. When you go into it, it will take you straight to our COVID page and give you our situation reports, our guidelines, our data. On our destination, you can go by a country. When you go into a country, it will be able to tell you which other hotels are using the THiS system. We'll tell you the list of health facilities and so on. You can also be able to register. By the time this app is up, you'll also be getting travelers' health tips and so on for travelers coming to the Caribbean. So I want to stop there really to take questions. This is our contact information. I do not have my email address up on this, but I think at the end of Openella's presentation, I'm hoping we will have both of ours. But we are on social media, and you can contact us as well. And feel free to also contact us through CHD as well as through email.
Dr. Inder, that was a very detailed presentation, and we have lots and lots of questions. So if maybe we can go through a few of them so that we don't probably, we address some of the ones that some are follow-ups to some of the guidelines that you've presented. But before we do that, I just want to reference on the chat we've circulated a training schedule that details all of the topics that will be addressed on this Caribbean Tourism Health Safety Training Series. Both CHTA and CTO are in the process of developing the individual registration links for all of those sessions. So be on the lookout for the information coming from the respective associations, organizations within the next 2 days. The information will also be available on the CHTA website, irrespective if the session is being led by CHTA or CTO. Also want to reference that the regional guidelines for the reopening of Caribbean tourism and travel that were just launched about 2 hours ago are available on our website, and they go into details, not only from a health and safety perspective, just highlighting as well the guidelines and specific measures that Dr. Aindar has just reviewed, but they also provide an overview as it relates to all of these sectors that are being addressed within the guidelines, which include tourism ministries, ground transportation, accommodation providers, food and beverage providers, as well as sites and recreations. So if we can go through some of the questions with regards to testing, we had a question, should temperatures of staff and guests only be taken on entering the property, or should there be different points within the same day to do this again? On mute. Not yet.
No,
Now.
yeah.
Yes, go ahead.
Yes, you're good.
So temperature check should be done regularly, but once we start with when someone enters. Now it's going to be very difficult to monitor someone like a guest, as they go from dining and so on. So we are suggesting daily temperature checks. That's the first thing. We are suggesting that for your guests as well as the employee, but not within the day. Because you want to make this as part of your operation, and then at the same time, it's a new norm, and how do you rearrange your operation to not overburden your workers and still try to protect as much as possible. So the suggestion is to do it daily.
Okay. With regards to the policies about the requirements of having face coverings, and both from a team member perspective and from a guest, any suggestions on how to handle any guests who refuse to comply with these policies? I'll let you take it, and then if anything, I'll add on to your response.
Well, I think the first thing we should note is that all our countries has now, well, to use, for not want of a stronger word, but they have all recommended and in some cases mandated the use of facial covering. So let's start with that. So you're entering the country, it's a country's requirement. So masks are required to be worn in public. We are not asking the guests to wear their masks, let's say if in their rooms, or if let's say they're in the water or they're in like around a pool area, just among themselves, just sitting within their family. But once they're in the public or interacting with the public, and with other persons outside their little group and within their family, they need to wear the mask. So I think it's how we say it, we can advertise this better in an effort to protect you as well as workers. We are encouraging the mask, and masks are required to be worn.
Yeah, and just to support that as well, communication is key, just from even the phase when travelers are looking at destinations and properties to visit. It is very important in the webinars that we've been presenting in our CHTA Live Resilience series. The surveys from prospective travelers have highlighted that prospective travelers are definitely looking for information in terms of what the regulations are, understanding how safe their trip will be. It's going to be very important. So on your websites, as it relates to having all of your protocols in place, it could be a breakdown of the major guidelines, but it's very important that your guests know from the time that they are booking of all of the requirements that they will have to accept pretty much if they decide to travel. And again, all of this is done for the safety of the traveler, but also for the population and the citizens of that destination. The same, I think, would go in terms of isolation. In terms if a guest is being taken their temperature and it shows that they are, that they have a high temperature, in terms of isolation, some of those processes in terms of making sure that the guest is isolated. If you have any reference that we could guide that process, and isolation versus quarantine. I cannot remember if that was highlighted.
No, that was not discussed. I didn't want to get too technical. But quarantine is if a person would have been in contact with someone who is positive, and that person, let's suppose, I was in a plane, I became in contact with someone who was sick. That person is positive, but I am negative. But to prevent any risk, I would be placed separately in whether it be in a separate room or facility. Most time quarantines, a lot of countries are using hotels now. So I'm not infected as yet, but I'm separate or in quarantine to see if any symptoms develop. And if no symptoms develop, then I'm allowed to leave. So it's not then, that quarantine process is different from if someone is actually a patient who has become confirmed. If a person is confirmed, they are isolated. Meaning now, you're definitely sure that they have COVID, you want to keep them away from everybody else, and you have to contact ministry here. Ministry has to know, and there is a Ministry of Health process. And sad to say, if you're a case, you have to then keep that person under watch for 2 to 14 days, because that's the time it takes for for the risk of transmission to be reduced. So you will have the person will be tested, and then they'll be retested after 14 days to ensure they are COVID negative before leaving. And again, it comes on countries. There are some countries that has isolation rooms within a hotel, like a block, or there are some countries that have a government facility for isolation, or a particular, particular area, not a hotel, but like a block somewhere else that may not be a hospital, but like an area they would have chosen to be able to do isolation. So it all differs, but quarantine is a person who would have come in contact with somebody who's sick. But that person, the person who's being quarantined, is not sick. They're just being there for observation.
Perfect. We have a question with regards to any team members that have pre-existing health problems, such as asthma and others. What are the recommendations from a health perspective to manage those? Right.
Well, the thing about COVID, what we have learned so far, is that people with pre-existing conditions, especially non-communicable disease, so heart disease, obesity, diabetes, those persons are at increased risk. Now, when you combine those with age, it gets even more riskier. So a person who has diabetes, we in the Caribbean are the most obese in terms of population density. So when you combine obesity and age as a person over 60 plus that, they become even more risk. So those are high-risk persons, so you have to be even more vigilant with those. So my recommendation is that they place in areas where they are not coming in contact with persons as much as possible, and that they are even more, you are monitoring them. So it's not, and you're monitoring them with temperature checks and all that, and they have to have that, you build a sense of confidence and trust where if they're not feeling well, they tell you, so that, you want to protect them, because most of the deaths, in fact, 90 About 98% of the deaths we have had is persons who are elderly with a combination of underlying risks.
Yeah. We have a question, and we're going to go probably about maybe 10 more minutes on questions. And then we'll go into a detailed presentation on this. That's correct, because there are a few questions about the system. You mentioned traveling groups should not mix. This is a challenge for hoteliers. Therefore, how should this be enforced? I think in terms
So the mix here is for during transportation. So we encourage as much as possible not to mix. If you have to mix, then you have to social distance as much as possible. So let's assume you have a big bus, then you should not be putting persons, in fact, you have to put persons 6 feet apart. You put your family that are close because they're already mixing. So one set of family, they're already traveling together. So we have to consider that, and they're already together. So they're like a plus. But the other family or the other person then has to be 6 feet apart from them. So in a bus, it might be possible. In a taxi, it may not be possible. So we have to kind of take the science and then implement that science to the logistics of it.
Perfect. If a guest test comes back positive, will the people that they got contacted with have to be separated from other people and then be tested? For example, they're tested at the airport, they travel to the hotel via taxi, and they're shown to the room by a front desk staff. By the time the test is returned, then those staff and the taxi driver may have returned to their homes already. So would they then be contacted and tested specifically, and presuming would not be able to work until their tests are returned?
The answer is yes. So that's the thing about contact tracing, and that's the risk we all face. So contact tracing is everybody that person was positive may have come in contact with. So if we have an illness in a hotel or someone that may have been sick in an airplane, it means everybody, and they will all be quarantined until tested. If they're test negative, that's fine, they go ahead. But if they're positive, then they will go through isolation.
Perfect. And the temperature guidelines in terms of fever is 100.4 Fahrenheit and 38 Celsius?
37.5 or around 38. Because the thing is, it's about 0.5 degrees Celsius. But some people normally sometimes have warm temperatures. So that's why, but once it crosses 38 and above, you're looking at fever. There's a lot of, in the science, some say 37.8, some say 37.9, some say 37.5. We here at CAFA, we use that kind of median. What we don't want for you to immediately get worried if somebody's 37.6. Only if they cross 38, then we want you to start thinking about fever.
Okay, and I'm going to go through one more question, and then we're going to have a very small break, and then we have a survey that we're going to be sending over. It's with regards to the temperature screening. Again, is it a best practice solely? So I think it's a little bit more guidance in terms of implementation and not.
Yes. I would recommend that as a best practice. We put that as one of our requirements. Guys, it's about layers of protection. So, countries also have their layers of protection. Some countries are testing, so they're making sure, that they're testing before or asking for pre-testing. They're doing their enhanced screening. But you now as a hotelier, remember that's your business. You want to protect persons that are, you want to protect your staff. You want to protect the reputation of business, and you want to protect your visitors as well. So it's just an additional layer, but we don't know what may have happened. Or some person too may have, when they now entered in the airport, the AC and all of that, and everybody's cold, those different things, your temperature may have gone, your exact body temperature may not have been appropriate at that time. So this is why, I don't know if I said this today, but when taking the temperature checks, we expect that the guests come out, they are in the lobby, and then you take the temperature checks, not just in the car. You want to allow them some time to acclimatize. You want to put all the barriers as possible because you want to reduce the risk. The opposite of that is if you have a case of illness, because you're dealing with a virus here, this is not going to be just going to stay within one person. It's going to spread rapidly among your workers, who would then take it home to their kids, and among your visitors, who would then, it's going to be a whole big spread. So you don't want that. It is going to impact on your reputation. So I look at it as layers or barriers. So temperature check is layer 1, mask layer 2, hand hygiene, sanitation, layer 3. And I know it's new ways of operation, but it's like learning to ride a bike again. If we put it in our operational guidelines, if it becomes our new norm, then we would just start doing it. I hated wearing masks in the beginning, but now I wear it. As soon as I'm out there in the public, I wear it. At CAFA, even though we are all know, we're teleworking, we are separating, we are allowed, every morning we have to take a temperature check when we come in here. So you make it as part of your operationals.
We have a question: can the virus thrive in the air condition?
No, we do not have data about how it is surviving. We do have data that it can stay on surfaces. So I would not recommend that air conditioner is going to kill it. We don't have that data.
Yeah, and I'm gonna finish with this question for now. So the double negative test prior to flight is not a guarantee that the individual is COVID-free.
So if a person is coming with a proof of COVID, PCR COVID test, then yes, if that person would have taken that test within 48 hours and that it has shown it is coming from a reputable case, a laboratory or respective Ministry of Health or health facility, and shows it's a negative PCR test, yes, it is guaranteed. However, you have to still keep doing the test, because someone can pick up they can be negative today, and they can become positive, or they may have picked up the illness in flight, during transit, by meeting somebody else. So you want to keep that daily monitoring.
Definitely. While we get the next speaker rolling, we're going to post on the chat a survey that we ask everyone to complete, preferably at this moment, so that we can get your immediate feedback on it. There are lots and lots of questions, and we'll do our best to go through these questions during the allotted time. However, there are some of the specific questions as it relates to either specific sectors of the industry, specific departments, that we will may not address today. However, they will be addressed during our next set of webinar series. The reason why we ask all of you to submit your questions specifically on the Q&A box is that the system records all of these questions, so we're able to download them afterwards and ensure that these questions are then addressed during our next webinars, but also in the communications that we continue to put out there as a follow-up to the launch of the regional guidelines. Are we ready to go to Ornella, or we're?
Yes.
And the survey has been posted on the chat. We really ask for your feedback. And we as well appreciate all of you that have joined us and are staying on through the entire webinar. The video recording will be made available within the next 48 hours. The regional guidelines for the reopening of Caribbean tourism and travel are available on the CHTA website on the homepage. We are also working on individualized sections for those guidelines. The entire document, it's a 72, 75-page document, which you are welcome to peruse. But we are in the process of just breaking it down by section based on the specific sectors of the industry. And that information will be posted as well on the CHTA website within the next 48 hours. And all of the details that Dr. Inder reviewed today are part of those guidelines. As well, we will make available a copy of the slides and the interim guidelines that are being discussed during this session. Ornella, whenever you're ready, you can unmute and proceed.
All right, can you hear me?
Yes, we can.
Great. So I am Ornella Marie Cyrus. I'm the epidemiologist and technical operations officer on the Tourism and Health program. This presentation is just to sensitize the hotel industry on what we have called the Tourism and Health Information System, how it can be beneficial to your facility, and how it can help reduce the impact of communicable disease outbreaks that we have been seeing, for example, with the COVID-19 outbreak. Lisa would have touched on some of these points in her presentation. The system is essentially an early warning and response system. It is web-based, so all you really need is access to the internet. And the whole idea behind it was to help to reduce or to stop the spread of communicable diseases so that you can decrease the reputational and economic damage, not only in your facilities, but also in your countries, because as we know in the region, a lot of the countries are heavily dependent on the tourism industry. One of the things that we always get asked deals with data and confidentiality. This system is not implemented to be a tracking device for your facility. We are not interested in how many cases that you have to come and tell you need to shut down. We're interested in you monitoring what is happening in your facility for the main purpose of being able to stop the spread of a disease and to ensure that your facility is healthy, it's safe for the visitors that are coming into it. When the people are filling out the reporting form that you would see a little bit later on, no names are required, so nobody is victimized or anything during this process. None of the data that is captured on this system is published. Like I said, it's not a tracking system for your hotel. It's simply something that you can use as an internal health monitoring system for your facility, and also on the end of the country users, the monitoring system for the country representative that would be assigned to the program.
Ornella, if you can get a little bit closer to the speaker and speak a little bit louder, we've gotten a few remarks about the speaker, the noise being a little bit low.
How about now?
I think a little bit closer.
Can you hear me now?
With some background. Let's try that again.
How about now?
Try that again.
Vanessa?
That's perfect. We can hear you.
Okay, great. So I'm going to continue with how exactly the system runs. So a facility that is registered on the system will report a case if a visitor presents and tells them what symptoms they're currently having. The facility has 2 levels of access. We allow for one level to simply be for data entry. This is usually the facility nurse, or if you want to designate your front desk staff, because sometimes those might be the people that your visitors will interact with to let them know that something is wrong. They can report the cases onto the system. The second level would be the data analytics level, and that level is usually given to the facility manager or operations manager in charge of that particular establishment. We did this because, again, we wanted to make the system as robust as possible. So limiting the number of people that have access to your overall data was the background idea here, with separating the access even at the facility level. There's another function that was instituted with the program on the request of some of the islands, and it allows for self-reporting. So if a guest or even a staff member would like to report, they can actually access the self-reporting function on the system and put in a report themselves. When the data is entered into the system, there is a designated individual in your ministry based on the country that would have access to the overall database for that country with all registered facilities. And when the data is entered by the different hotels, if an alert is generated based on the cases that have been reported, the people at the ministry would have access to this so that they can investigate the alert that has been generated. They can contact the facility and they could come up with a plan together to start actioning to ensure that there is no spread of disease. On the regional side, we see overall aggregate data for the region. So what that allows us to do is to see if there are any trends happening over different countries so that we can contact those countries and again, come up with more of a regional plan to figure out what can be done. How the system works, we monitor symptoms. So we're not asking anyone in your facilities to become doctors. We are just asking you to record the symptoms that your visitors or even your staff members are experiencing. The symptoms under surveillance here are the same symptoms that CARFA monitors through your local and national health systems in what we call syndromic surveillance. And that is done on a weekly basis. And how we do that, we look at diarrhea, vomiting, fever, cough and sore throat, bleeding, headaches, joint or muscle pains, eye or facial pains, generalized rash, blurred vision, and other. The other was included here on the request of a country because they realized that in a lot of their facilities, some of the actual reports that were being recorded were due to violence and slip and falls. So we instituted that as an extra layer as part of the monitoring system. So how do you move from symptoms to syndromes? A combination of the 10 or 11, now that we've included the accidents and injuries, a combination of those symptoms can lead to any one of the 6 syndromes that are monitored regionally. So for example, if you have a combination of diarrhea with vomiting, that could lead to or possibly be classified as gastroenteritis. Now we know that gastroenteritis could represent a number of different things. For example, that pesky bug that a lot of people have to deal with in their facilities called norovirus. Another thing that is frequent would be undifferentiated fever. If you have a combination of fever and at least one of the following, being headache, joint or muscle pain, eye pains, or vomiting, it could be classified as undiff, which would give us an idea if there's something like dengue actually currently spreading within your facility. Each one of the particular syndromes has a pre-calculated threshold that even on the ministry level is followed. So the idea is once your reports in your system surpass the particular threshold, an alert will automatically be generated. Each one of the different syndromes have different thresholds. So if you're looking at something like gastro, as it's the most common, anything greater than or equal to 2% of your total staff and guests would result in a system-generated alert. So when this alert is sent, one, the operations manager who has the access to the data dashboard, that email address that is provided to us upon registration will receive an alert letting them know you have now surpassed your threshold. An alert will also be sent to the country representative. Why this happens is so that there could be immediate collaboration between the ministry and the facility so that nothing is allowed to go or get out of control and the issue can be dealt with one time. When you register, we ask for a lot of different information and people tend to wonder, what is the reason behind all of that? Now, the system calculates what we call an attack rate to determine whether or not you meet those pre-specified thresholds. And in order to calculate that attack rate, you need to know the occupancy rate for both your low and high seasons. You need to know what those periods are for your low and high seasons, the number of rooms that you have in your facility, and the estimated number of staff you have at any one time. And you also need to know the average number of persons that you usually have per room. The equation that you see here, that combination of that information will give us the attack rate, that would be used to determine whether or not you have surpassed your threshold. So like I described earlier, there are 3 different users on the system. You, the facilities. We are also expanding the system to not only include hotels and guest houses, but to also include health centers and the transport industry, as well as tour operators. So anybody at what would be still considered facility users would have access at that level. We will always have our country users in the Ministry of Health. These are usually the epidemiologists or the surveillance officers, and a lot of the times actually the environmental health officers attached to these ministries. And at CAFA, it would be myself and Lisa that would have access to the overall regional aggregated data. So how do you register? We've tried to make it a bit easier. We initially had a paper-based system for registration, and now there's a Google Doc. You simply enter your information and press submit. That information is received. The computer will generate your login information and password. As soon as this is sent back to you, it's sent to the accommodation manager. That person can now designate who their data entry individual would be and provide them with that login details. And once you receive that email, you can start immediately by visiting the THiS.cafa.org website. So when you go onto the page, this is basically what you'll see. You have the 2 options that I would have mentioned, the self-reporting option and the sign-in if you are going to sign in as either a facility, a country user, or as CAFA. At the bottom of the page, you also have our terms of use, our privacy policy, a link that will take you straight to our THP website that will give you more information about the program and about this application, and also a link that will give you access to our contact details if you need any further clarification. When someone clicks on self-reporting, all they are able to access is the reporting form. They can't go in to see any of your facility data. They can't see anything other than this form with the pre-existing questions. When you click on sign in, it takes you to this login. And I would have mentioned you would receive your login details with the email address and password for your particular facility. And it is very, very important that when signing in, you click the right level of access. If you are a hotel and you put in the correct username and password, but you click the wrong level, so for example, you click on country instead of facility, you will not have access to the database. So always remember to click the right level to access the system. On the reporting form, there are 11 questions. Some of them have pre-existing answers, so you just scroll through and select one. Others, you actually have to enter something. So for the first thing, we want to differentiate between guest or staff. So it asks if you are a guest or a staff at the facility. The name of the hotel and the country the hotel is in would be pre-populated based on your registration. Age, while the age is there for the individual to input, it is not mandatory. What we do ask is that they at least give us the age group that they are in, because that information is very important when we're looking at demographics if there is indeed an outbreak for us to do our outbreak investigation. After the age group, you have gender, male or female, the residence country, recent travel, and we would know within recent times, those 2 questions are quite important given what has happened with COVID, knowing where people are coming from is very important for us to have an idea of what could possibly be the cause for their illnesses. And then the symptom occurrence date is also important. Putting down when this person first started experiencing their illness can give us an idea of how far along a possible outbreak actually is in a facility. And then number 10 would be the symptoms. The 10 or 11 symptoms that I would have gone through earlier. It's a yes or no question for each one. You just click yes or no if they are experiencing any of those symptoms. And then it also allows you to add additional information that they may be willing to give you that can later, if there is an issue and we have to do analysis, the additional notes will be helpful in figuring out what has happened or transpired. So I would have mentioned before how we use syndromic surveillance to help us when it comes to monitoring our communicable diseases. So gastro, like I said, could be linked to something like norovirus. If you're seeing an increase in fever and a rash on your system, it could possibly be measles. If you're seeing an increase in fever and respiratory on your system, anything from influenza to Legionella. Fever and neurologic, you could be looking at mumps. Fever and hemorrhagic, you could be looking at anything from yellow fever to Ebola. And undifferentiated fever, most times in our region, is always related to dengue. Now, the system really was developed with the facilities in mind. We know that when it comes to monitoring things like diseases, it's not always the easiest if you just, bum rushed with a whole bunch of tables and a lot of pages and pages of information. We try to make it as user-friendly as possible so you can easily see what is happening in your facility. When you log in, the first thing you see is what we call the dashboard. On this dashboard, it gives you a breakdown of all the information that would have been entered into the system. The first graph that you do have access to shows an overall picture of what has been happening in your facility for a designated year. When we do disease surveillance, we operate based on what we call epi weeks, which tends to correspond with the weeks of the year. So you see from week 1 to week 52, all the peaks and troughs of reporting for the year for a particular facility. Other graphs are also available. We do breakdowns based on whether it's guest or staff, breakdowns based on age group, breakdowns based on each individual syndrome, so that you can have a clear picture of what is actually happening. Like I said, it is very user-friendly. You don't have to work too hard to figure out what the graphs are showing you. Once you hover over each one of these graphs, you get these nice drop-down boxes that gives you all the information in a nice little table there to tell you exactly what you're seeing. Everything is color-coded, and it will let you know for, like in this graph, for a particular age group, what is the occurrence by each syndrome. It has also been incorporated into the system to allow you to download these graphs that have been generated very easily so that you can now use it in your own reporting. And it's not necessary to do double reporting if you have to do health reports for your facility. On the country side, when a country user logs in, they just see an overall how many facilities are registered in their country, what those facilities are, and what the counts are for the particular week. We tried our best to ensure that there's a lot of resources available for the users. So there is a tourism and health information system manual. It's a little bit lengthy. So we try to condense that information and make them into flyers. The first flyer that you see on the screen would be the flyer to tell you how exactly to use the system from registration to use. And the second flyer that you see is a flyer that you can actually use in your facility to leave around for your guests to see. That helps them become part of this whole process. Because at the end of the day, we need them to report that they are actually feeling unwell for all of this to work for all of us. Again, we have a virtual resource available as well, a YouTube video that basically goes through everything that I just said. So if you need a refresher on how to access the system, how to use the system, you can visit this site and have a look. It's about a 10-minute video, but it's very, very comprehensive. So at this point, I will attempt to give you a live demonstration of the Tourism and Health Information System.
And while we get to that, as a reminder, the video recording of this training series will be made available for download at the CHTA website within the next 48 hours. PDF of the interim guidelines is available on the CARFA website, will also be posted on the CHDA website and distributed to attendees. And the regional guidelines for the reopening of Caribbean tourism and travel are currently available on the CHDA website and available for download.
Okay, can you see my screen?
Yes, we can.
Okay, so like I said, when you sign in, you see your data analytics dashboard. If I go to a future year, you can have an idea of a year that has more populated data. On the side here, there is a drop-down box, and you can click in between to choose different data ranges. So as you see here, we would have started the system in 2017. So from every year, you can choose to just look at that particular year. If I click on 2018 and I want to look at Epi weeks 1 to 52, apply filter, this would have been my activity for 2018. When you look at your overall graph, if you want to just look at what has been happening with gastro in your facility, you can actually click off all the other syndromes and just focus on one at a time. So it is very interactive. It allows you to manipulate the data to suit what you are trying to analyze at that point in time. When you scroll down, you then see the number of syndromes reported among guests versus staff by age group. Sometimes depending on the syndrome, it's important to know what age group is really being affected, because it gives you a better idea of what could possibly be the cause of that outbreak in your facility. Once you hover over each one of the bar graphs, you get a readout of what the bar graph represents. You then have a breakdown of number of reported syndromes by gender. You have the breakdown of each one of these syndromes. So number of gastro reports for the year, you would see it guest versus staff. Again, hover over each one to get a readout of what the graph is showing you. At the top of each one of the graphs, you can choose to individually export it, or at the top here, you can export all of the data that is present on your dashboard. So if I now change over to 2020, I will show you what happens when we report a case. So I'm going to say that I'm a guest. Like I said, certain ones are pre-populated. So this is our demonstration account. So it's pre-populated with the name of our demonstration, hotel, and the country that it's in, and what type of facility it is. If I put in my age, it automatically would give me an age group. If not, you can simply use the drop-down box to choose the age group of the person making the report. You select the gender. You select a home country. Recent countries travel to, let's say, I say, I've been to China. Right? Now we get down to the syndromes. If I say I've been having no diarrhea, but I have been vomiting, I have had a fever, I have a bit of sore throat, I have a headache, I've had some bleeding, but I don't have any joint pain, I have eye aches, I have no rash, I have no blurred vision, and I have no injuries due to violence, and I press submit report, it says my report has been submitted. So when your data entry person enters this information and you as the manager log back into your data analytics dashboard, you're supposed to automatically see for the week This is week 26. You now have a log for both undifferentiated fever, and well, yesterday we would have done another example, and that has gastro, but you are now seeing where that report automatically populated your graph and shows that you now have a report of undifferentiated fever in week 26. So the more that you enter information, you will see your graph evolving, and it will just give you a snapshot of what is happening in your facility. Another important thing to remember is not having a report is something good. We're not expecting everybody to always have a case. If you are following all the protocols and procedures, it is very possible that you have no illnesses reported in your facility. If this is the case, we are interested in finding out if you have 0 reports for the week. So what we ask is that a short email just be sent. We usually send out a reminder every Thursday evening, because the way the system works, like I said, it's based on weeks. So we try to send a reminder every Thursday evening for you to log any reports or to confirm 0 reports for the week by replying to the email. And we then register this to know that, okay, for this facility for this week, there have been no reports. And actually for you as a facility, logging a 0 report consistently for the year is great. That is something you could use as a marketing tool. It says, look at me, I've been doing all the stuff that has been recommended. My facility is healthy, my facility is safe, and I've had 0 reporting for the last 4 to 6 weeks consecutively. And that is basically it for our tourism and health information system. If you have any questions, feel free to ask.
Yes, we are encouraging all of your questions on the Q&A section. If you can, there was a comment specific to somebody trying to register at THiS.carfa.org, and it went directly to a login page, not to a registration page. Is it?
Because there's a link. The link in that PowerPoint is the link to the registration form. I can try and put it in here, if that would be helpful.
We can certainly share it on the chat. That will be very helpful. And while you do that, I'm going to go first to a few of the questions that are specific to the THiS program. I registered on THiS. We usually used to get weekly updates, requests for reporting via email. However, since COVID-19, we have not received the email. Will this resume?
Yes, it will. What we did is we actually stopped that email because so many of the facilities indicated that they were closed, since a lot of the restrictions were implemented in the different countries, and we did not want to be a bother with this automatic email filling up their inbox if they weren't open. And we did see a huge reduction in reporting because the facilities weren't open to the public. So yes, we are going to get back into our weekly reminder for reporting and for ensuring that you actually report on your system or letting us know if there have been 0 reports for the week. It will resume.
Okay. A question. During the earlier segment of the THiS presentation, only a few islands were listed for the rollout of the system. Will the system eventually be made available to all Caribbean countries?
The system is available to everyone. The countries you would have seen listed would have been the countries that initially participated in the implementation of the whole tourism and health program that would have been funded by IDB. But any facility in any one of the Caribbean islands can register on the system. Whether or not the whole program is implemented in a specific country is based on that country coming to CARFA and asking for us to now come in and implement the whole THP. But in terms of registering, you don't have to be in one of those countries to access the THiS application.
And just to reconfirm, currently the THiS application is available to accommodation providers exclusively?
No.
Okay.
The way the system is set up, anybody could honestly, a hotel can register, a guest house can register, an Airbnb can register. It is already set up for health centers to register. Right, and we are going to look at making the provisions for if it's a transport company, if it's a tour guide, it would be a simple thing of adjusting the user access, but the system itself would be the same.
Okay, So currently, if a transportation provider or an attraction is interested in signing up as of now,
They can still fill out the form because the change is something very small for us to make. Once we do see that there is the interest, it can be done.
perfect. I don't think we have any questions more that are specific on the THiS overview, but I'm gonna go through a few of the ones from before. So bear with me just 1 second as we go through this. Is it mandatory, and this are probably for you, Ornella, or Dr. Inder as well, is it mandatory to keep records of all body temperature monitoring or only the ones that exceed the maximum range?
Well, it's not mandatory, but it's a good way because it's a form of record keeping to see. It's your way to show if a person came in with illness, how they develop, if they developed it at your facility. It's a good way for tracking. So, it could be a simple Excel sheet or a simple right there as a person's temperature is recorded, you record it right there. But it's always good for record keeping, both for I want to say for good and bad, just to make sure
Yeah.
that you can have that. Yes.
Okay. With no data available with the potential exposure to COVID-19 in an air-conditioned environment, is the recommendation still exist for dining indoors?
I don't understand. Is it that?
I think it's pretty much is it the recommendation to have most of the access for dining outdoors? Actually, it shouldn't be indoors, but
We would have changed that. We originally, because countries would have had restrictions, so they would have stopped dining, in-house dining, and that was to avoid. It had nothing to do with air condition. It had nothing to do with temperature. It was to avoid persons crowding. So now that countries are opening, the dining options are again open. But again, now the new norm is that you have that 6 feet apart.
Mhm.
So we do not know, and there's not enough scientific data to say, if hotter conditions or if colder conditions are causing it, because I know there isn't literature out there that suggests that may suggest, well, maybe the Caribbean have had less cases because of a hotter climate. But we have had hotter climates in other parts of the world where they have seen, look at Brazil, right? That's been hot and you've seen very high cases. So our situation in the Caribbean has worked because one of the things we have done and done very well is that we close our borders very quickly. Most countries waited for hundreds of cases. There were some countries that actually closed their border without a case. So closing the borders and doing the restrictions of closing schools, any form of crowding, and then later on face masks, that helped us to blunt the curve as we see. We did not have that spike. We actually kind of flatten it or blunt it as much as possible. So that has been the thing. It has nothing to do with temperature. But as dining now, we do not want to restrict. And I'm saying this because the hotelier, if your hotel has a lovely kitchen and it's known for a lovely restaurant and it's known for that, it's now about repurposing to ensure, look, instead of 3 feet or 1 feet apart, have to go 6 feet apart in terms of dining.
Mhm.
In terms of where the tables are set and so on. So it
Okay.
doesn't matter if it's outside or inside.
This was in regards to the previous reference about testing, I guess probably temperature checks, but just to reconfirm, when a guest arrives, you do not recommend them being tested upon exiting the taxi, but once settled into registered acclimatized.
Well, yes, it's all because if you have AC, it could be under AC conditions, it could really deter or impact on your reading. So we noticed that when we were doing our temperature checks, I'm driving probably an hour. By the time I get there, my temperature was reading sometimes 35, which is kind of impossible. That's because the cool air was breathing on my face. What we do now is just before I get to car for maybe about 5 or 6 minutes, I put the glass down to acclimatize. So you don't want to take a temperature check as soon as they walk out of the taxi. You may get a false reading. Remember, the idea is not to check the people's temperature, but it's to really protect. So you want to check when they are acclimatized, they're back, they're standing in line after, by the time they reach your concierge, set it up then. So give them a few minutes to acclimatize, and you're getting a more correct region then, the likelihood of getting a better or more correct reading.
Perfect. What is the best practice for a guest showing serious symptoms who is traveling with a companion or children in the same room? Should the family be quarantined together until the suspected case is transported to the isolation facility?
So are you saying that one person is having symptoms and the others are not having symptoms?
It would seem, yes.
Okay, so in that case, yes, because they're already sticking together, a family tends to stay, the treatment will be that the family would stick together. However, if one comes positive, then the others are quarantined while one comes isolated. And I know it's two different words, but it's just how one person is treated as opposed to the other. The others will then be contacts. They will quarantine separate once the person with symptom turns out to be positive. If they don't, then they are quarantined until the symptoms go, if they all turn out to be negative.
And I think
they stick together.
This next question is probably, it's just a follow through on maybe just another overview for those that may have joined later. But if a tourist enters through airport and is symptomatic, what are the health department steps to minimize risk for hotels and not have them proceed to their accommodation?
So this varies by countries. So we just developed a protocol, a regional protocol for health and border security, and it speaks about 7 steps: enhanced screening, and the testing, as well as having a travel history question and so on. But every hotel has every country has a screening process. So I can use Antigua because they have just opened. They are doing a travel health questionnaire. They are asking you, if you have been in contact with anybody who have shown symptoms or who have been sick, have COVID in the last 14 days. So it's a process of elimination. Then they are doing testing. They put you on hold for 24 hours until you get that results. Then you're allowed to go into the hotel. So that's protecting the hotelier. So when it comes to the hotelier now, you kind of have some level of assurance that that first level is already done, and you're not really knowingly, and I say knowingly because we know that there have been asymptomatic cases where you may have illness. We know that sometimes persons may develop, someone could pick up the illness while they're at the hotel or in transit and all of that. So there are many things that could happen. This is why we're telling the hotels to also implement layers of protection.
Yes. And
but if someone is sick, but if someone is sick or deemed sick, like in many countries, so Jamaica is doing it too, they would have had cases, they immediately isolate them, test them. They are not allowed to go and proceed with their holidays.
And this is along the lines of the temperature monitoring. Should it be done both at the point of entry and exit, or only at entry?
No, it could only be done at point of entry, and it should be daily so that you could know, because if a person staying 5 days in the hotel and they may have become infected, you would want to know what is happening on day 2, day 3. But when people leave, there is exit screening at the hotel, at the airport.
With regards to face coverings, should kitchen associates wear both the face coverings and face shields?
Wow, that's an interesting question. So it's already hot in the kitchen. So the face shield offers that full blocking. If you're talking though in the kitchen and if you're not covering your mouth, then there is a problem. So you can wear the face shield if you're not talking, if you don't have a lot of talking, because the face shield, it covers your entire face. So, but if you're talking, then the chances are there's a risk of that droplet still coming out from the face shield. Because when persons do surgery and all that, they wear the mask and they wear the shield. So it all depends on the level of activities. If you think the face shield is easier once it's offering that border, that level of protection, and you're doing a task and there isn't a amount of talking and all that, that's fine. Because I know the mask can be restrictive.
Mhm. Yes, and this is somebody that may have joined later. What is the correct procedure for checking temperatures? I noticed that different procedures are being done for the same type of machine. Is it necessary to have contact with the machine? And if you have to, shouldn't sanitizing between checks become necessary?
Okay, so the key for for prevention, COVID and any other illness, viral illness, is preventing contact. So at no time should you be using any thermometer that would allow you to touch a person's skin. So there's a lot of thermometers out there. Of course, the further away, the thermometer that takes temperatures further away is going to be more expensive. So you have the temperature guns that you can stay about 6 feet apart and so on. And if you're really following social distancing, you should really be taking it, to be able to point at least 6 feet apart. Yeah, and to take breathing.
What is the best way to deal with PPE for housekeepers when they are required to clean 10 rooms in a shift?
Okay. So there's a couple of rule of thumbs. If your PPE gets dirty, if it becomes moist or gets dirty, you need to change. Number one. If you're doing the same task for more than 4 hours, you change. All right, so those are some general rules. Plus, if you are cleaning a room and you noticeably know somebody has been sick in that room, it may not be COVID, but you must know if somebody vomited, or you see a very dirty bathroom, and that sign of norovirus, which is also a viral thing, bug that spreads quickly. Then PPE, as well as the cart and all of that, and the linen has to be separate, and her PP, his or her PP has to change immediately as well before going over to the next room.
Great, great. We are pretty much close to our end time, the allotted time for the session. We had previously referenced that there were a number of questions that we may not have the ability of responding because of time. We do want to remind everybody in attendance that this is just only the first of a series of trainings on various subject matters, and some of those questions that were posted on the Q&A will be addressed specifically during our next sessions. The schedule was made available on the chat. We'll also include that same schedule on the materials that will be distributed, along with the link to download the video recording of today's training session. We've also recorded all of those questions to facilitate that we review that they are indeed handled and discussed during our next training series, which to that effect, our next training series is on, if you, I just lost that document, but if you all give me, yes. So just as a reminder, the regional guidelines for reopening of Caribbean tourism and travel are available on the CHTA website for download. Currently, the document that it's available, it's the full document that has all of the guidelines for all of the sectors that you see here on the screen. Within the next 48 hours, we will have the individuals sections for all of those sectors. We want to take this opportunity to thank Dr. Indar and Ornella from the CARFA team for such a detailed description of those interim guidelines and the overview from a health and safety perspective, as well as the THiS program, which if your property has not signed up for it, we strongly recommend that you do so. Being registered under the THiS program is part of the requirements for the recognition for the Caribbean Travel Health Assurance stamp. Our next webinar is next Wednesday, July 1st, and it will be on the matter of accommodations, public areas. CARFA will provide a brief overview and recap of some of the highlights from a health perspective. We will be joined at that specific session by Ecolab, which is a global expert in the area of sanitation and hygiene as well. Para todas las compañías y los individuos de habla hispana, el seminario se va a realizar también en español, específicamente a las 3 de la tarde, el próximo miércoles 1 de julio. We really thank you for your time today. We thank you for joining us as well. Please visit our website, CaribbeanHotelAndTourism.com, for any further information, resources, and as usual, if you want to be added to our communications, make sure that you email us at membership@CaribbeanHotelAndTourism.com. With that being said, I would like to thank everybody for joining us today and wish everybody a wonderful afternoon. Thank you so much.
Bye.